And welcome back, everybody. Hey, our last guest is the founder and CEO of ZiphyCare Incorporated. Yes. And she joins us to speak about her company's app and how she's innovating the healthcare industry. So please welcome to the show, Dr. Rada Sumareva. Welcome.
Thank you so much.
Rada, thank you. Now, it's a pleasure seeing you again because the last time I saw you, we were doing something for NASA.
That's correct.
Yeah. And you're always there. You always have... And wait a minute, we did something else at Harlem Week, too. Didn't we see you there? Or your team at Harlem Week.
Yes.
Tell us a little bit about your company and what it's all about.
Sure. So ZiphyCare stands for Zip Physician, where Zip means fast and also means a zip code. No matter how great of technology you have, if you don't work with communities and do not engage patients, you cannot be successful. So we pay very close attention to working with communities and engaging patients.
Yeah.
ZiphyCare is a cutting-edge technology that enables a completely new healthcare delivery model. After virtual house calls became popular during pandemic, we realized the value of meeting the patients where they are in their homes. Because we have access to their living environment, we have access to the magic medication box, not just the list that's compiled by someone else for them. So now that we realize it, we really have to work on a model that will bring the doctor to the patient's home. Yeah. And telemedicine is sort of addressing it. However, people that we are working with from underserved communities not necessarily have high bandwidth internet or have computers or know how to operate this complex technology. And also on the physician side, there is only so much you can tell by just flat screen conversation with the patient. So what we are doing differently, we are bringing the best of in-person and teleworld, and we implementing a hybrid model. We are sending a medical assistant with our proprietary technology to the person's home. They connect with the physician when they're there, and they become an extension of doctor's arm. They apply stethoscope to your chest. The physician is listening to your heart and lung sound, looks in the throat, looks in the ear, looks at the wound, examines the wound, looks at the EKG done in real time. Everything that they doing in their primary care setting, except their remote, and medical assistant is navigating technology to help them assess the patient. Yeah. That medical assistant is also licensed phlebotomist, so they can draw blood, they can collect any other lab samples. So, and the doctor has access to all of this information and can really provide some sophisticated diagnosis for the patient.
Yeah, although it's new technology, it comes back around like old technology. A doctor making house calls.
Exactly.
ZiphyCare is in your home making house calls.
Exactly.
I like that. Yeah. So you started this back when?
We started it in 2018. It took us a couple of years to build technology and bring it into the field. As a provider myself, I know how difficult it is to bring new models and new technologies to healthcare community. So we knew from the beginning that we would want to have affiliated practices. And our first practice, believe it or not, was founded 3 months before COVID. Yeah. Little did we know that it would be so useful. And we actually, through our work with social service agencies like Self-Help, Washington Heights and Inwood Y, and others, were able to become a safety net for many vulnerable New Yorkers during COVID.
Yeah. Wow, you guys had the vision before COVID came in. Yes. Now, we posted up some steps. Can you go through these steps with me?
Sure.
Go back and post up those steps again. Talk about that.
Right. So this is our patient-facing app. To be quite honest with you, a lot of patients don't have access to smartphones. Yeah. So they don't have to go through the steps. They can just call the number, and our sophisticated dashboard allows to book this appointment. Right. Yeah. But if you do have, for example, caseworkers, case managers can book these appointments for patients, or you can book this appointment for your relative. So in that case, you would download the app, available on both iPhone and Samsung. And you just go through very easy steps to book an appointment with a doctor. And usually you can be seen by a doctor that same day.
What are some of the healthcare companies that you work with to keep this going?
So we actually mostly not working directly with patients. We are working with businesses that serve patients. So we work with healthcare insurance companies, mostly managed care, Medicaid, Medicare companies. We work with hospitals. We work with social service agencies. We work with large physician groups like IPAs, ACOs, MSOs, and we help them connect with their most complex, high-risk patient.
And the other organizations and vendors that ZiphyCare works with?
So that would be, for example, managed long-term care payer organizations. It's an alternative to nursing homes.
Got it.
Yes, hospitals for physician groups. Our technology, I was born and raised in Ukraine, so our technology is as far as Ukraine today, also helping people in refugee centers and in recently liberated territories.
Yeah. Excellent, excellent. Where can our audience find ZiphyCare in our communities? How can they get the service? Is it within the 5 boroughs or the tri-state area?
Yes, we actually do. Not just tri-state area, we also in New Jersey and Florida. But again, they would have to be referred by one of our partner organizations. To book an appointment with us, yes.
Okay.
But services that we offer actually range from anything like chronic disease management at home for diabetics and congestive heart failure patients to flu shots and anything else that and it's so much better to do it in the home. You can also see if there is a risk for the fall for an older patient and if anything needs to be installed to prevent it. You can see if that's the right size of the wheelchair in order to enter to the apartment, not necessarily all coincides always. So bringing it to a patient's home makes a lot of sense.
Yeah, and Rada, you've been doing this for some time, so you have the background and the experience and the knowledge to move all of this stuff forward, to be able to work in this space, right?
Sure.
Tell us a little bit more about your background.
Sure. So I'm a healthcare provider by training and entrepreneur by trade. I had my own practice for 20 years. Actually, I started, my first patient was seen in Mount Vernon, not far from here.
That's the other Bronx.
Yes, that's the other Bronx. But in my practice, I've seen a lot of patients with chronic diseases, multiple chronic diseases, that were cared for by different specialties. And as the more advanced we become as a specialty, the bigger the wall is between us. Between different specialties. So I was always big advocate for integrative care, for team approach in treating the patient. I also was part of United Healthcare provider committees that were working on different programs that would improve utilization rate of preventative services and disease management for people from vulnerable communities. I also co-founded my own conference that focuses on issues of people with disabilities and their caregivers. So I guess all in all, was always interested in access to care and innovative programs for at-risk communities. And ZiphyCare is a culmination of everything I've learned, of all the challenges that exist on doctor side, patient side, and the payer side.
Would you like to see it, where would you like to see it go from here? When it grows, it goes where?
So we actually, as it grows, we're going to keep partnering with more and more doctors' organizations or health plan organizations where they would utilize their own doctors, their own medical assistants, and we will train them in our technology, because that's the fastest way for us to be able to deliver this type of services to those who need them the most. And we have about 134 million of Americans who actually belong to this category. These are the people who have one or more chronic diseases, people who live in remote communities, underserved communities, people who are 65 and older. We can help them.
Yeah, and you have wonderful people working with you to help get the word out, like Marion Scott.
Sure.
Yes.
Marion is our community engagement
She said,
champion.
She likes to lay low, but, we got to give her props, too.
Absolutely. Bravo.
Bravo.
Right. But our goal is actually, I think we're solving for 2 problems, Bob. Not just access to healthcare. And that's a very big problem that we have in the US. Even New York today is a healthcare desert. But I think one problem we often overlook is health literacy. So, and you can build offices on every block, but unless you educate the patient and unless you build the trust between the doctor and the patient should know why they should see a doctor, what outcomes to expect from this visit. And that's exactly what we are trying to help with, not just bringing healthcare access, but also educating communities. Our staff, our medical practice staff speaks different languages, admires all the cultures. We do pay a lot of attention to cultural sensitivity.
That's important.
Yes.
Very important.
Yes.
Yes. And I like what do we call it? Medical literacy. So
health literacy, yes.
So they can go onto a website, or how do they learn that from?
First
from
of all, our person who comes to that home can help educate the patient because they're in the home. Even physician can see this patient very differently. We had a recent story where a patient with congestive heart failure was pretty much said that he needs to see that he needs to be referred to a hospice. Yeah. Because he was disoriented, he was older, English was not his first language. Right. When our physician saw him on the screen in the home, he was cooking for himself, he was cleaning for himself. All he needed was a few hours of home health aid in the home, which with help of our physician, he is now getting. So it's actually getting closer to the patient and learning about your patient.
And sometimes that helps too, just seeing a person come to your home. You know, some people are lonely. Exactly. And they want that interaction with a person. And that will help them to move into that area where you become cured.
Exactly. You want the patient to become their own advocates. Yeah. I mean, I think our parenting, I know you're very passionate about education. Yes. I think our parenting model has changed significantly in the last couple of decades. We try to engage kids in making decisions. We try for them to actively advocate for themselves. But in healthcare, we still live a lot of times in the order wall. This is what you need to do. Yeah. Yes. You need for the patient to understand why they need to do it and what to expect.
Well, I'm happy. I'm happy and glad that there's an organization like yours that goes out and touches the people and educates the people.
It's not only that, because all of this findings, all of the readings from every instrument, the sounds of the stethoscope, the images from the camera, the image of the EKG, everything stays on the platform and it's available to every care team member. So now you can enable true continuity of care. If a primary care physician saw this patient, this data is available to cardiologist, endocrinologist, to the case manager. And now we can get together and actually speak the same language and collectively try to help the patient.
Yeah. And so these are also patients with the Medicare, Medicaid, or you take all kinds of insurances?
Absolutely. These types of services are covered by insurances. Actually, peer organizations find it very helpful that now they have their eyes on social determinants of health, on the living environment.
Yeah. And this is different from telehealth because, you know, of course, that came out a little bit bigger or more during COVID-19. But you go in and you touch the lives of these wonderful people.
Absolutely. As some people call it telehealth on steroids.
Telehealth on steroids. I like that. Well, listen, thank you for all that you're doing. Is there anything that we missed that you would like to tell our audience?
I think the fact that actually I personally and our company believes in doing well by doing good. So there is a lot of initiatives that we love to be part of. We are working with a couple of organizations that are helping new immigrants. We come to churches, we come to community centers.
Yeah, that's important.
We do community wellness events. So
yeah. You know, I was talking to a young lady, a principal of one of the schools, and she says she has about 200 additional people in her school, and these are asylum seekers, and so they're looking for health care, and they're looking to get some staff from the school, get together with the parent, and physically take them to a place where they can get shots and get the things that's needed
They don't need to go anywhere. We can come.
You can do it.
We can come on their campus.
I'm going to put you in touch with one of the principals.
Absolutely.
Marion, that's perfect. Because that's one school. That's just one school. They're all over the place.
Put us in touch. Absolutely. That's very much within our alley.
Now, where do we go for more information about what you're doing, Doc? Is there a website or social media?
ZiphyCare.com.
ZiphyCare.com. Just like that. Spell it out.
ZiphyCare.
It's right there on the bottom of the screen. Put it on the bottom of the screen one more time. It goes right there. There it is, right there.
Thank you so much, Paul.
Dr. Rada Sumareva, pleasure to meet you.
Same here.
Thank you, Marion, for bringing the doctor here, and you're always welcome. My house is your house. And vice versa, right?
Absolutely. Absolutely.
Hold on 1 second. I think we're going to wrap this up. I think we've run out of time. Thank you for tuning in. Thank you for checking us out. Keep following us on BronxNet TV for continued coverage. Thank you for letting us share in this space and time with you. You can join our host, Kibben Arlene, Darren Jaime, and Rena Valentin for new episodes of Open, Tuesday, Wednesday, and Friday. Always remember this: what you are is God's gift to you. What you make of yourself is your gift to God. You choose your choice. Let your choice control the chooser. I'll catch you another day, another way. I love you all. And I'll see you over 107.5 WVLS. Peace.